cold enough for you guys? Well, we appreciate the opportunity to meet with the President today and discuss health care. And as he conceded and a number of the majority conceded, there are plenty of good Republican ideas. The core problem is this. We don't think a 2,700-page bill that cuts $500 billion out of Medicare, raises taxes by $500 billion, and drives insurance premiums up is a good idea. What we think you ought to do is start over and go step by step and target the areas of possible agreement that we discussed in the meeting today. Frankly, I was discouraged by the outcome. I think it's pretty clear that the majority, including the President, want to continue with basically the Senate bill, which has even been made more expensive based on the President's recommendations that were put on the Internet a couple of days ago. But we're happy to continue to discuss the areas of agreement. It's just that I do not believe there will be any Republican support for this 2,700-page bill that the American people are so overwhelmingly opposed to.
Peter, how do you think?
I think the American people want us to work together on common sense steps to make our current system work better. American people are concerned about health care. And there are some areas that we do agree on, that we can work together on to take steps to make our current system work better and bring down the cost of that system. But we can't do it within the framework of a 2,700-page bill. That's why the bill needs to be scrapped. We need to start over on those things that we can work together on to make health care less costly for the American people.
Let me just say one thing quickly. I wrote a note to myself at the end. I just don't think the President was listening, even though he invited us to hear our ideas. He actually consumed more time than all of the Republicans combined or all of the Democrats combined, and much of it was responding to our ideas. So it wasn't a matter of just inviting us down to listen to our ideas. He wanted to argue with us. And there's a reason for it. There's some fundamental differences of opinion. I respect his. I think he indicated he respected ours. But it's not going to be possible with that kind of an approach to come together within the time frame that he indicated if you insist, as Senator McConnell just said, on starting with this 2,700-page bill and then tweaking it to adopt some of our ideas. The whole concept of the bill, with its government mandates, its taxes, its spending, and all of the other features of it, are what make it unacceptable to us and to the American people. And that, I think, is where we have to start.
It sounds like there's a stalemate. So what's the next step?
Well, you've heard what we recommend, that we scrap this bill and start over. We also ought to listen to the public. We know that the average of all of the public opinion polls indicate Americans are opposed to this bill by 55 to 37. Interestingly enough, Gallup just this morning polled Americans on how they would feel about using this little-used reconciliation device, and by 52 to 39%, Americans are opposed to doing that. I think the message is very clear. The American people have followed this issue like no other in the time I've been in Washington. Everybody's interested in their own health care. They do not want this bill. It's time we started listening to the people that we represent.
Senator, was this a waste of time?
I wouldn't call it a waste of time. It was a good discussion. You had in the room, I think, virtually all of our really knowledgeable people on the subject, so I would not call it a waste of time.
Senator, not to be argumentative, it sounds like you think it was a waste of time. You just said to us at the end of an all-day meeting the same thing you said very early on in the healthcare summit.
Right.
And what was gained by all those hours?
Well, the President kept saying the same thing, too. I mean, I think it's pretty clear on this big, important issue. We have very strongly held opinions on both sides, and we think the best way for this to be resolved is to pay attention to the people who sent us here, who were speaking overwhelmingly, saying, do not pass this bill.
I do think, in terms of the meeting, it was worthwhile. It was pretty clear throughout the meeting there are a number of areas that are in agreement. But let's take those issues that are of agreement or things that we can work together on, and let's package those together and do them. But we can't do it in the context of a $1 trillion bill that has all these tax increases and Medicare cuts in it. Thank you.
Thanks, everybody.
Thanks. Senator McConnell, do you think the Democrats have